And I have seen sort of over the past 5 years, my mum, who's a nurse, talk more and more about it. And I've watched the conversation go like, someone will present and say, "Hey, look, we need to be concerned about the NHS being privatized," and then the response quite often is, "Oh, don't be stupid. The NHS isn't being privatized," and I'm never quite sure like what response to give to that. Like, how do you get that point across, and why is it something we should be concerned about?
Yeah, it is really confusing because there's different parts of the NHS and there's lots of contracts that go on within the NHS anyway. Like, for example, a piece of equipment that gets bought from a private provider or blood tests or whatever else, which obviously not all of those things are NHS branded. They're bought from outside the NHS, and that's been the way for a long time. But increasingly in recent years, private contracts have been handed out to private providers like Virgin Healthcare and others. And it's happening increasingly, really. We've just found out that a large American insurance company have bought the contracts to a number of GP surgeries, particularly in London, and that's causing a lot of alarm, I think, because it's a confusing thing to understand. Some people see GPs as private providers anyway, but GPs run a service which is they have one employer. The employer is the NHS. The NHS is the only thing buying their services. It's not kind of a free market, and the GPs aren't working in a kind of free marketplace. Whereas if you've got people coming in like insurance companies who are potentially looking to skim a profit off the top of public healthcare, we get more concerned that patient care could suffer as a result.
I mean, the insurance market being brought in is something that I have to. Like the realization that costs money is something that I don't think many people realize. Is like, as soon as you bring in like an insurance market, like someone has to pay for all of that, like all the salaries of anyone in the insurance company, all of the actuaries who work for them, all the underwriters, like the processing of like, all the data that has to go back and forth, and it can add up to like a seriously increased cost of healthcare. Like, I spoke to Dr. David Belk, who wrote a book called The True Cost of American Healthcare, and the way in which the insurance companies just sort of not only like swindle the system but end up making astronomical profits is terrifying when someone's health is involved.
Yeah, and I mean, we're not there yet, but I think for people like yourself, Josh, who are reading those types of books and seeing what happens in the States, it is quite terrifying thinking, is this the route that we could be going down? And why are American insurance companies interested in investing in GP surgeries over here? And it's not to say that we're at that point yet, but I think there's a lot of people starting to get alarmed about it.
Yeah, well, I mean, I'm definitely one of them. I can't express enough why that's a bad idea. But another one of the issues that people have kind of raised as a problem is that the fact that the NHS is constantly accused of being like chronically underfunded. Like, is that a reality from your guys' perspective? Is that actually the case?
So that again, it's a very difficult thing to try and explain because the NHS becomes more and more expensive year on year. We've got an aging population, and also medicine, as it becomes more advanced, as the treatments become more complex, it becomes a more expensive thing to run. And so actually, in order to kind of keep up with the baseline of what it costs to run the NHS, you're having to put in more and more money each year to keep things at the same level of kind of service provision. Now, things have been underfunded and services were cut a great deal during the kind of austerity years, 2010 to 2020. About £40 billion worth of funding was taken out of patient services. A lot of roles were removed, staff roles, which were really essential for running a really excellent service for patients. And patients are kind of getting a worse deal as a result of that. From my own perspective as a psychiatry doctor, we lost a lot of the kind of allied health professionals who would have helped the doctors and nurses get the jobs done well. So we lost a lot of art therapists, psychologists, a lot of those really specialised roles, which really make the NHS special, because it's not just about delivering kind of acute medical care. The NHS is about creating a really healthy lifestyle for people, and we've lost a lot of that investment over the recent years.
Why do you think it is that those programs have been cut? like, or why were those programs chosen?
Well, I think after the credit crunch happened, those in government were trying to make very difficult decisions about what they thought within society could be cut from the public budgets. And the NHS is a hugely expensive thing to resource. I mean, from my perspective, clearly as a doctor and someone who's made this my career, I think NHS is a priority, and I think it should have continued to be funded in a way that was going to keep patients safe. I think if you've got a different outlook on this and you feel that people should fund some of their healthcare themselves, or you're trying to move the country towards a model where people are partly paying for their own healthcare, maybe public health system becomes less sort of overarching, then maybe you've got a different outlook on all of this. Speaking cynically, I think a lot of NHS campaigners feel that the NHS is being underfunded so that services fail and patient confidence in the service drops, and then it can be privatised and replaced with something different, which is a bit of a depressing way of thinking about it all. But when you read those books, Josh, that is the sort of feeling that you get when you're reading people who've really studied this and are looking at it over the long term. That does feel like where we're going.
I mean, it's something I actually like to slightly sidetrack and plug my book. It's something I actually like talked about in my book, that I was concerned that post Brexit, whatever sort of economic damage was done would be used as an excuse to either further underfund or ultimately privatize more and more services. And I think COVID is probably going to make that situation even worse. But one of the things we chatted about sort of briefly yesterday when we spoke was that to me it seems like the cuts and the lack of funding over the past sort of 5 to 10 years has put us in a position where we were incapable of handling any kind of surge of patients that like has happened at different times over the past year. Like, to what extent do you think that underfunding has caused the strains that have been seen on the NHS this year, and how much worse has that been, if at all, compared to like any of the last sort of 10 years of winter crises? Because like one of the things that people like Peter Hitchens kept pointing out is that we've seen winter crises every year, and people have been screaming about our people being treated in corridors, and ambulances lining up outside hospitals for years, and it's been like in the hearts of people for years and sort of never touched, and yet this year it seems to have become, well, possibly for the better, but a much bigger issue.
Yeah, you're absolutely right. It has I think there's been efforts to try and streamline the service at various time points, which have cut areas of the service, cut staff numbers, have reduced bed numbers, and that sort of thing. And what happens is it means that the NHS doesn't really have anywhere to go when things become busier, because they're always running at full capacity. So if you suddenly get more patients becoming sick, there's nowhere to put people. There's not enough staff to look after them safely, and it puts us into these dangerous situations every single winter, as you know. And during COVID, you're right, the cost actually has been enormous as well, because we weren't prepared for a pandemic. So not only were we not prepared with bed numbers and things like that, but we didn't have enough PPE, and the amount of money that we've had to hand out as a country to buy PPE at inflated prices when we're desperate for it at the last minute. It's unbelievable the amount of money that's been wasted. And we waste a lot of money in staff costs as well, because you've probably seen stuff in the papers about locum rates. What happens is we're understaffed, we don't employ enough full-time members of staff all the time, and then suddenly it's a winter crisis, we're desperate for staff, and NHS trusts are forced to fork out these massive hourly rates for staff because they can't cope in any other way. So it's not very sensible long-term planning, to be honest.
Thanks so much for listening. If you enjoyed the show, please subscribe, follow me on Twitter, or sign up to our mailing list. Thanks a lot to our sponsor, ExpressVPN, the #1 most trusted VPN. Get lightning fast connectivity with servers in 160 locations across 94 countries. Keep your browsing privacy safe with ExpressVPN, and get a 35% discount on 12 months of ExpressVPN when you follow the link in the description below. Don't forget, my book is now out and available to order on Amazon and on bookshop.org. That's Brexit, the Establishment Civil War. And most importantly, thanks for listening. We'll see you next time.